So with Pilates, everything moves from the core outward, and that is related to having the curves that should belong in a spine, so what we would call neutral. And this is where I had some learning to do to realize that some of the curves that were in my spine were actually excessive, and that finding neutral was going to be a middle ground within the mobility that I have, and understanding that as I was able to make the curves in my spine more symmetrical through specific movements, that took away some of the imbalances of muscles that were chronically weak or chronically tight, feeling chronically short. So through Pilates, we're looking a lot with the articulation of the spine evenly through the entire spine, and then making sure that those curves in the spine are supposed to be there. And I'll let Angie talk a little bit more about what those curves are supposed to look like from the anatomical perspective.
Awesome. Yeah, so spinal curves are basically, there's 4 spinal curves, and they alternate going up and down the spine in a way that guarantees that your head sits directly over your tail. So your head and your tailbone should line up at the top and bottom of this curve set, and everything in the middle should sort of zigzag back and forth in such a way that your spine is stacking the weight directly vertically. So the curves that most people know about are the lumbar curve, which is sort of that lordosis, that arching of the low back. And that's going to match up with the cervical spine curve, or the neck curve, which is also a lordotic curve. So if you were looking at me sideways, and obviously I'm not going to be a great image here because I'm wearing a shirt, but my neck should curve with the convexity basically putting to the front, and the concavity in the back, and the lumbar spine should be the same way. Then you've got your thoracic curve and your sacral curve, and those should be kyphotic, meaning they're the opposite. So you should see those bending and rounding from back to front. Interestingly enough, neutral spine is basically the summation of these 4 curves. So it is when you are in your most upright, relaxed position, theoretically from a PT standpoint, it is ideally when you see the natural motion of all of these curves. What I was struggling with when I was a new PT was they show you this beautiful image of this, skeletal structure with these perfect curves. And there's a certain number of degrees that are considered normal, and everything outside of that range is considered abnormal, which meant that every patient I saw was abnormal. So 5 years into treating, I was still looking for this beautiful normal human that my anatomical diagrams were based off of, and I've yet to meet him or her. Maybe they're out there, but they've never come to me in the clinic or hung out with me during any aerial activities. So my understanding of neutral spine at this point as a clinician is that it is your neutral spine. There is such a thing as too much lordosis, or arching of the low back, and there is such a thing as too much flattening of the low back. That doesn't mean that Christine's curve and my curve are going to be the same. Our neutral spine may be slightly different. What we're trying to do as practitioners, as a PT and as a Pilates instructor, is help our patients and clients find their best neutral, which tends to lie, like she said, not on the periphery of motion, but somewhere towards the center. If you're hypomobile like me, you're a little more flattened, you have a harder time relaxing to find that neutral spine. Someone who's more hypermobile, like Christine, may struggle to find the neutral spine because they're too lordotic or too arched. So what patients hopefully take away from a visit with me or working in the clinic is that while they may not achieve the true perfect lordosis or kyphosis, those alternating curves in the spine, they're able to identify the position in which their back is the most supported while their muscles are the least engaged. So a way to stack the weight without having to overwork the muscles to do so. So that's sort of the neutral spine that I work with clients. And that's tougher to find than you think, because most of us tend to go into extremes of motion to lock down the spine. And that's going to kind of segue into our next topic. Don't judge yourself if you think you're a little too flat or a little too lordotic. You may not be all that far off neutral. It might just take a professional helping you find, where that is for you.
And one of the things I would say about that is, in 10 years of practicing Pilates, I've seen the curves of my spine change as I've changed activities and as I've specifically trained to work on certain things. So We're just looking at a starting point, which gives you the opportunity to make all kinds of changes. So to observe your body, both feel from the inside and take a look at it from an exterior view and figure out where you're working from and where you might be able to make a change to that, because Pilates will often describe the spine being like a slinky. So if you change one portion, there's going to be other changes all over the place. And like Angie said, if you have that optimal positioning for shock absorption, it's going to give you the most space in between every vertebrae and disc, so that in impact activities, you're going to have a healthy spine for a long time. And in terms of the engagement of your muscles, you've put them all in a position where everything's doing the least amount of work in order for you to then move. And so then all of the movement, all of the effort from your muscles can then be translated into power and control, rather than stabilizing a posture that's less than ideal.
Absolutely. Interestingly enough, there used to be theories in PT that the curves were built out of completely the lumbar spine. So you would change the curve in your thoracic spine and your cervical spine, your neck, based on your lumbar spine. So when I first graduated from PT school, it was all based on, does the person have too much anterior pelvic tilt in their pelvis or too much posterior pelvic tilt? And if you fix that, that magically changes everything. What I've found as a clinician is that you can screw up your low back curve by having too forward a head posture. So if you have a desk job and you've got a bad setup at work and you spend, 6, 8, 10, 12 hours a day at that bad setup, you're going to mess with your lumbar curve simply because your head and your neck position is different. So this idea that Christine touched on, where you are sort of a product of your activities and your spinal curves are a product of your activities, is right on point. So it is modifiable, it is changeable, and you need to be aware that it can be adjusted top down or bottom up, or from within. If you've got somebody, to give a personal example, I am happy to state that I was always a relatively small-chested individual, and I was cursing the day that this was my genetic background. I thought that wasn't fair. Now I have a 6-month-old who likes breastfeeding, and I will tell you, my thoracic curve has changed dramatically, because now I'm carrying around 6 to 10 ounces of milk on the front of my torso, which I wasn't before. So now I have a great kyphotic sort of thoracic curve, whereas before I was really flat between the shoulder blades. And that's caused all kinds of neck changes, low back changes. And interestingly enough, it's caused changes in flexibility, caused changes in shoulder strength. So these curves really do matter, and how they change actually changes how the muscles attach and work on them, which Christine touched on, this idea of efficiency and not using muscles for the wrong reasons. So if you can take anything out of this, it's that, your curve is yours, it's changeable, it's different, and it should not be something that you obsess over. Wait, that's the PT side of it. Yeah, you should not feel like you are awkward or different than anybody else. Just know that, if you know you're normal and you know you're neutral, or you know how it's changing, that gives you some power to train the right things moving forward.